For the remainder of the presentation, we will be discussing strategies for responding to phases of the acting out cycle. Remember that even if everything goes perfectly, you'll still have students that escalate. During the peak stage, the overall behavior is out of control, creating safety concerns. This might include behaviors such as physical aggression, severe tantrums, property destruction, self-injury, running, or screaming. During the peak phase, the intervention is focused on safety only. The behavior of the student is driven by emotion. This isn't a thinking behavior. Thought is out of the equation. The focus is on crisis management. Not all behavior has to be dealt with right now. You can deal with this later after the student is de-escalated. So some short-term interventions to consider would be isolation or removal of the involved student. Allow the student time to cool down. So provide an area for cool down. And it could include removal of other students, which may involve a total room clear. Remember that phases go back and forth, and some behaviors have to run their course. During the peak phase, responses that you want to avoid include agitated behavior from the staff, such as shouting, cornering the student, engaging in power struggles, moving into the student's space, touching or grabbing the student, sudden or very quick responses, making derogatory statements about the student, arguing, becoming defensive, body language that communicates anger or frustration. Do not communicate urgency to gain control of the situation. Instead, you want to speak calmly, speak privately, minimize body language, keep a reasonable distance, move slowly and deliberately toward the problem situation, speak respectfully and privately, establish eye-level position, be brief, stay with the agenda, avoid power struggles, and provide the student space. During the de-escalation phase, overall, the behavior shows confusion and lack of focus. This might include confusion, withdrawal, sleep. They may have their head down, denial, blaming others. They may respond to concrete direction, and they may apologize and try to make up. But remember that when de-escalation begins, you're no closer to baseline than you were when the student was in the acceleration stage. And this is a time that you're going to need to give the student strategies to get them back on track. When the student is de-escalating, the intervention is focused on monitoring for re-escalation of behavior. So monitor for health and safety of all involved, avoid blaming, and provide the student an opportunity for non-judgmental discussion, allow cool down time and space, and engage in independent work, provide easy, concrete tasks. If the student is uncooperative and needs more time to settle or to complete the task, make sure it's a task that the student has mastery of. Set reasonable standards for completion, such as neatness, time allotted, but do not move to the next step until the task is completed. After debriefing, determine an appropriate consequence. For instance, if the student tore up the room, then they must clean it up. If upset at another student, they must do something nice for that student. Attempt to restore the environment refers to cleaning up. If an area already is cleaned up, then the student needs to be given some community service jobs in the room. Do the steps in order to gain gradual compliance. You will want to debrief and problem solve after the student is calm. The students have a memory. There's no need to do this in phase 5 during the peak. So this is a really simple problem solving format that you could use, asking 3 different questions. What did you do? You want the student to name the behavior. Why did you do it? In order to determine why the student did it. What else could you have done that would meet your need and be acceptable? So you want them thinking about what they may do the next time should the same issue arise. A debriefing session will include the adult facilitating a transition back to the task or activity. At this point, no further negative consequence. The goal is to increase appropriate behavior, to focus on problem solving, to try to pinpoint events that contributed to the incident. We want to teach replacement behaviors and provide debriefing activities and forms. The last phase is recovery, and overall, the student behavior shows an eagerness for busy work and a reluctance to interact. So you may see subdued behavior. They may fall asleep. They may want to complete independent work. But keep in mind that the students are still very fragile at this recovery phase. During the recovery phase, the intervention focuses on returning to normal activities. Utilize effective consequences. This is not the same as punishment. An effective consequence includes modeling, instructing, or teaching a more appropriate behavior, determining whether the consequence interferes with the flow of instruction. Does it give the learner the choice to redirect or receive instruction? And is the consequence effective? We also want to positively reinforce any displays of appropriate behavior and debrief and rehearse problem-solving routine and review and revise a plan as needed. There are 4 key strategies I want you to remember. Number 1, teach and reinforce expected behavior skills. Number 2, identify how to intervene early in the escalation sequence. Number 3, identify environmental factors that can be manipulated. Number 4, identify replacement behaviors that can be taught. This handout can be used to plan de-escalation strategies for the student and for the staff who's working with the student. But just planning de-escalation strategies on a student-by-student basis is not enough. Systemic school-wide strategies and supports need to be in place for effective prevention of problem behaviors. Think about what you've learned from this de-escalation training, then answer the questions on the slide. Write down your answers to the questions and make a plan to follow up on obtaining more information or support, and on checking to see if you really accomplished stopping and starting certain behaviors. The goal of the session is to become fluent so you can respond in a planned way that is automatic and smooth when problem behaviors occur. So at the end of the session, you'll find these questions. What will you stop doing? What will you start doing? What will you take back to your school or classroom and do differently today or the first day of school? What do you need to know more about? And what support do you need from others? At the beginning of the session, I wanted you to think about these questions that you would be answering now. So take a few minutes to jot down the answers to these questions. What will you stop doing? What will you start doing? What will you take back to your school or classroom to do differently today or on the first day of school? What do you need to know more about? What support do you need from others?